Hi, I'm Terry Arnold, and welcome to the IBC Network podcast called IBC. And I have with me Ivy today. And Ivy is one of our IBC sisters, and she has some unique things that she wants to share of her experience. And so, Ivy, let's not waste any time. I've been really looking forward to getting to talk to you. So, why don't you tell people a little bit about yourself and your pre-cancer life, and then we'll start talking about inflammatory breast cancer. It kind of invaded some things.
Yeah, great. I am so excited to be here and share my journey with IBC. Pre-cancer, I was active, running around with kids kind of person, and full-time, I have full-time job, so I'm a chemist. So I, was working a lot and playing a lot kind of person. And no, October 2021, I woke up with hard breast. And I just thought that it's some kind of an infection because I never thought that the breast cancer could look like that. So the next day I went to see my gynecologist. I actually saw my nurse practitioner there, and I owe it to her. I owe my life to her. She looked at me for the first 2 minutes and she's like, get dressed and come to my office. So I went to her office and she was already on the phone making arrangement for me. And she then told me that there is an inflammatory components to your breast. So I am very concerned. So we're going to do all the testing. I'm sending you to see all the specialists, and then let's talk. And then a couple of weeks later, I was officially diagnosed as stage 3B inflammatory breast cancer. And then later on, I found out that there are oftentimes who are misdiagnosed, but I was, I guess, one of the lucky few that was diagnosed right away with IBC.
Well, I understand that yesterday was your birthday, so I think it could be a good idea to shoot that nurse practitioner a happy thank you for my bonus birthday card, because I love it when they see it, they know exactly what it is, and they don't waste any time.
Yeah, and Terry, I actually went to see her yesterday.
Oh, well, good.
Yeah, I went to see her, and she's just amazing. And we talked about intimacy with cancer. So that was like my
That's a tough one.
Yeah, that was like my main conversation with her, because I feel like nurses have more practical information and advice than doctors. And so I felt really comfortable talking with her about, intimacy part. But yeah, I did go see her yesterday, and it was amazing to be able to be there on my 47th birthday. And I'm, another assurance that, hey, I'm here. I went through this, and I'm still here.
That's great. I want to say something really quick, and I get what you're being about the nurses. I think sometimes the doctors, whether they're male or female, they tend to look at the overarching disease and not necessarily the whole quality of life. And I think it's just a time issue thing. But yeah, I think it's good that she talked to you. But also, a lot of people don't realize this, but a lot of major hospitals have intimacy clinics and things they can tell you and help you understand. I know for myself, I thought there was a strong lack of desire just because I was tired. Well, apparently I was missing a few hormone components to make things work well. And so then it made me shift my mind. There's just so much we could talk about.
Yeah.
But I'd like to hear more about what happened to you, because you got this beautiful diagnosis. You responded very well to treatment, from what I understand. I remember when you were first diagnosed, we talked at the beginning, but you've had a little hiccup along the way that I think you would like to share. It's a little bit of a cautionary tale, because sometimes I think in the IBC world, the lack of conversation about appropriate reconstruction leads to confusion about what appropriate reconstruction is. So where do you want to start? We don't have to start there, but I know you've got some things on your mind today.
Yeah, so after I got double mastectomy with lymph node dissection on the right breast.
Well, you had the chemo first, right? So let's make sure people know that. You had the chemo first.
So I had chemo first for 5 months, and then I had double mastectomy because I have the gene mutation. And then I had 30 radiation sessions. So everything was done by the end of August of this year. And I was just focused on recovering, doing physical therapy and whatnot for my shoulder issues, since, I still don't have full range of motion. So I still seeing my physical therapist about that. And then one day I noticed my shoulder here really hurts. So during like sudden movement, or when my kids attack me with their hugs and whatnot, then, my arm, like shoulder area here would hurt. So obviously my first thought was, oh my gosh, what is going on? And so I called my doctor, and she wanted to do an MRI for my shoulder. But during the process, it turned out that because I have an expander on my non-cancer breast, I cannot do MRI testing.
Now, do you actually have the expander already?
Yeah.
Is it, so you had the pocket placed to hold the expander when you had your double mastectomy?
Yeah,
right?
On the non-cancer side.
On the non-IBC side. So you're flat on the other side.
Yes. So
Now,
I am flat on the other side, yeah.
Right. Did they tell you anything about how that could maybe compromise? Because you're finding out it's compromising to things you want to do, right?
Yeah, yeah.
I'm not saying it's compromising your overarching care. This is your non-cancerous side. I mean, obviously we don't want that to happen to the cancer side for reasons we can talk about later. But, your body, you walk in there a whole person. And what happened about wanting to get this MRI?
So I walked into the MRI site, and they were about to reel me into the machine, and I'm like, something's not right with my breast. And then the technician asked if I, and he's like, oh, you have an expander, we can't do MRI on you. So I ended up coming home. So it was so that's when I realized, am I doing the right thing to prepare for reconstruction in the future? I knew that IBC patients, you needed to wait for a year or two before you even talk about reconstruction. And I was totally fine with it for waiting, but I just didn't think about like the healthy breast impact of the healthy breast to the cancer side. Because, we have a pair of boobs, and when you get MRI done or CT scan or whatnot, you just cannot get one side done. It's like the entire upper body getting it done. I didn't really think about it when I made a decision to be okay with putting an expander on in the non-cancer side.
Now, see, what's interesting is that nobody counseled you about what that can mean for your aftercare.
Yeah, yeah.
So I'm just kind of wondering how that conversation did it just not come up from them, or?
It didn't come up since you have IBC, the impact of expander is this. Like, we didn't have that kind of conversation, but it was more like just a conversation for regular breast cancer patients, that, you're going to go through radiation on the cancer side. And so you are going to be a candidate for the deep flap later on. But your healthy breast, we can still put in an expander so that it can be prepared you can prepare for yourself for the reconstruction. So the conversation, they were very thorough with, pros and cons of deep flap versus the silicone implants and whatnot. So they were like very thorough with it. And I had lots of follow-ups with my plastic surgeon, so that he, monitors my expander and whatnot. So I'm very grateful for that, but there was just no conversation about IBC specific impact to reconstruction and expander. And I didn't pay attention back then because A, I didn't know, and B, I feel like, I'm sure a lot of us feels like this, like we're just running a marathon at very fast pace. Once you are diagnosed with IBC, you go through this, you do this testing, you do chemo. Right after that, you got to focus on getting mastectomy. Right after that, you need to focus on getting radiation. So I just didn't throughout all that process, I did focus on, okay, I'm doing chemo, I should be mindful of this. I'm doing mastectomy, I should be mindful of this. So I was doing that. But when it comes to reconstruction, I just felt like, whew, okay.
Yeah, you're almost at the end.
Yeah, I'm almost at the end. Whew, okay.
Well,
so
and my thing is, I always feel like they're not going to offer something to me if it's bad for me. Like the other day I was talking to a researcher who was doing a paper at San Antonio, where some hospitals are trying to give patients anesthesia. They get an MRI just so they'll be more relaxed. Well, the problem is they give you your anesthesia, you're on your back. They have to flip you over to put you into the machine, which often takes 7 to 8 people, and they're worried they could hurt you.
Yeah.
She said there's risk involved, whatever, but it's becoming a more common request from patients, and doctors are saying yes. And my deal is, if they tell me I can do something, it doesn't occur to me that might not be a wise choice.
Yeah.
And I think it kind of got started because some patients have a lot of anxiety about MRIs, and maybe that's the best choice, but it shouldn't be the blanket choice. But like with you, like if somebody says, would you like a glass of tea? You say yes. Would you like dessert? You say yes. When someone offers you things, you say yes. I've learned the only time you don't say yes is at the airport. Someone put something in your suitcase. One time I didn't understand the lady, and I said yes, and the next day I knew they were searching my bag. When you're supposed to say no at the airport, but you're just saying yes. Okay, that seems okay. And now you realize you can't get an MRI. And I wonder, breast cancer patients get MRIs for follow-up, whether they have IBC or not. So I wonder what is a reasonable time frame to wait to even use that. But there's another way this expander has gotten in your way. You were trying to be part of a clinical trial. Did they explain that to you? I thought that was a really big deal.
Yeah. I wanted to contribute. So there was a clinical trial at Dana-Farber to scan the brain for to look for metastasizing to brain for inflammatory breast cancer patients. So I wanted to participate, but because of the expander on my left breast, I am not a candidate for it. So I was a little disappointed because it's not only me contributing to IBC world, but at the same time, it's great to get free MRI scanning done on your brain every 6 months. So I was looking.
Yeah, because that's not done for us. And I know that trial you're talking about, Dana-Farber, and you're a great candidate for it. They're looking for people. What they're trying to do is figure out. We know that sometimes it shows up in the brain so quickly with very little symptoms. They're trying to do some MRIs to see if they can't find some more less maybe noticeable changes to help us find those warning bells.
Uh-huh.
And you would have been a perfect candidate, but you can't be in it because you can't get an MRI. That was it, right?
Yeah.
That was the thing that ruled you out. And so I think those things are important too, because people don't realize what strategies are involved in clinical trials nowadays. And you just can't. It's like a chess game. If you have to do certain things certain ways, or you can get precluded. So what is your next step now?
So my next step, I want to believe that I have really good relationship with my current doctors. So of course I have meetings, appointments set up with them to talk more about it. But I did go ahead and set up an appointment. By the way, I'm not getting treatment done at one of those 3 IBC centers, but I did go ahead and made an appointment at Dana-Farber towards the end of this month to talk to them about the reconstruction. So I'm just not a naturally anxious person. I'm not a warrior kind of person. So I always feel like, okay, well, let's figure it out. I mean, I have an expander on my left healthy breast, but I can always take it out. I'm sure I have, sorry about this. I have smart doctors working with me, so we can figure something out. So I'm not anxious, or I'm not worried. So the next step is to talk to my doctors and Dana-Farber and figure it out.
Well, good. Well, and one of the reasons I thought it'd be good to talk about this is, one thing I've been asking the international consortium, because some people say, oh, they hear the MD Anderson standard, but what happens is Dana-Farber and Duke and MD Anderson and other doctors around the world get together and make a standard. So it's really the international consortium standard, not necessarily the MD Anderson standard.
Yeah.
It's a collective decision. But the reason they say to remove the breast and don't do expanders is some of the things you're coming with the limit of follow-up, but also when you had the pocket filled, there's a timeline of those things. Now, were you doing that during the same time of having radiation, or did they do that a little bit later?
You mean
because they put the pocket in at the mastectomy. Did they put in the expander right away?
Yeah, they did. And it was the feel for the expander was before radiation.
Okay, so they did it all in the beginning. Because what happens, I see sometimes with women, they'll get an expander put in on the IBC side, and then they're getting radiation on the IBC side, which is definitely no bueno. I know, I see your face. And what happens is,
Mutation. Yeah.
you know, you're at a disconnect. You know, your body is needing radiation, but your expander needs to be put in, and it has its own timeline. And then that radiation kind of beef jerkies hardens that little breast mound where it can't be the most attractive cosmetic outcome. And then sometimes the skin can even tear with the radiation. So I'm glad it wasn't that side. But still, it's a shame that you're seeing a complication. And you know, I think so often though, as cancer patients, we think, wow, if I can bundle some of these surgeries and kind of be a one and done, but that's just kind of not how it works.
Yeah.
You know, I wonder if that's kind of how it was presented to you, that, oh, this would just be easy to do this now.
Yeah.
You know,
I don't really remember the, you know, exact conversation that we had, but everything that my doctors laid out for me made sense to me back then. I'm like, okay, well, it's healthy non-cancer side, and they're gonna put the expander in, and then the breast cancer side is I'm just gonna go flat, and yeah, that makes sense. And I know the reconstruction could be delayed for IBC patients. And so, yeah, I guess it makes sense that, you know, the cancer side going flat. But I'm not a medical professional. So like, you know, I don't know all the details that are involved. I wish I had known, if I had known, I would definitely advocate for myself more. But so far, I feel like I've been advocating for myself really well with my doctors, and they are very like open to listening to my concerns. So that everything was great until that MRI incident about a month or 3 weeks ago or a month ago, that I'm like, oh my gosh, maybe this is why it's beneficial to get your treatment done with IBC specialist. And I know not all of us can travel to MD Anderson or Dana-Farber for their treatment and second opinion and whatnot. But there is definitely a benefit of doing it. And I am very lucky that my doctors, I mean, they were like very knowledgeable about IBC, and everything they were talking about was same as what I found in literature about IBC. So I felt really comfortable with going with my current doctors. And I still don't regret it. They're awesome. I don't regret it. And yes, there was this hiccup, but as I said, let's figure it out. And thankfully for my shoulder pain, my physical therapist was examining me, and she was thinking that I have frozen shoulder. And so she kind of, you know, did frozen shoulder, I guess, physical therapist.
It's very common.
Yeah. And a day before she did that, on the first session with her, my shoulder felt much better.
Oh, good.
Yeah. So right now, I mean, I don't have pain on my shoulder. I still have limited arm movement because of the, you know, lymph nodes being gone. So I am thankful that I don't have that, oh my gosh, what if it's a bone cancer, right? So I don't have.
Oh, I know.
Yeah, I don't have that.
It's
anymore.
hard to have your imagination not go crazy. I had a lady call me one day, here's my big toe hurts. I'm convinced I got toe cancer. And she was laughing. She knew, but she was just saying that your mind just instantly goes there anytime anything hurts.
Yeah.
You know, I know. Well, you know, and it's interesting when you talk about, you know, nobody can travel, and I get that, but I think it's really important that we know what the standards are. But it's hard. You're right. You're not, you know, you're an educated person. You're a chemist, but you're not a medical doctor. And then not all medical doctors know every single thing.
Yeah.
And people say to advocate for yourself, but I swear I'm a born advocate. That's my thing. But it's hard to advocate for yourself, first of all, when you're sick and you're not feeling your best, your brain isn't firing on all of its cylinders, but also this is a whole world. You don't know the language. You don't know what's going on.
Yeah.
And then you've got kids, you've got work, you've got other things. I mean, how many hours are there in the day?
I know.
And how much energy can we do?
It was crazy, but thankfully, my husband's aunt is a nurse, and she knows a lot of, you know, medical lingos and medical language. And so she was, from the day one, she's like, these are the things that you should be asking for. And then she would go to appointments with me, and she would like demanding to doctors, like, Ivy needs this right now. And she was like doing that. And I'm like, oh, that's how you do it. And so I was really blessed to have her on my side from the beginning to the end. And she's still advocating for myself, and she's still going to Dana-Farber with me at the end of this month.
Oh, that's terrific.
Yeah, so I am very fortunate to have a family member who knows about that. So like I've been kind of brainwashing my kids, one of my kids, that, oh, you should be a nurse. Because I think it's amazing to have a nurse in the family. But
we need them. We need them.
Yeah, but
well, you know, it's interesting because one of the reasons I wanted to talk to you today is sometimes people get the wrong care. They think the whole world's gone to an end, and it's not. You're saying things like, you know, I'm not worried. I just got to figure this out. And it's also good because I can see, to me, this is almost like a very innocent situation. You call it a hiccup, where this is your healthy breast. You didn't think it was going to be a problem, and it kind of got in your way. So I know sometimes people think I'm anti-reconstruction, and I'm not. It's just because I didn't get it for a long time. So people just thought, oh, she's down on reconstruction because she didn't get it. I had cancer in both my breasts. This side was triple negative IBC. The other side had an older triple negative tumor. IBC actually saved my life. They found the older tumor that was about to get me. It was really deep in my body, and it wasn't showing up on any test. So I had both breasts removed. At the time, they didn't think I was a good candidate for reconstruction because honestly, nobody expected me to live. They really didn't. And then, you know, after you go through all of this, the idea of any more surgery, any more hospital time was just not what I wanted. I was so grateful to be alive, and I didn't want to mess anything up, in my mind, mess it up by getting reconstruction. Not that it would mess it up, it's just that's how I felt. Yeah. What if I stirred something up, you know? Yeah. And then I waited a long, long time. I waited 10 years. So I call myself a late bloomer. And I got the deep and I got a double reconstruction. But one reason that really pushed it for me is some new surgeries that are coming into play to help with lymphedema. They were able to reroute some of the nodes. And so to me, it was like a double win to get to do it. Yeah. But one of the reasons I do speak up a lot about women being careful with reconstruction is I met a ton of women who got the wrong care. I mean, I don't mean like you, I mean like same day reconstruction, really bad care, skipping radiation to not, you know, disfigure the new breast mound. And they didn't make it. Yeah. And these women have come to me and said, please, please be my voice, be that caution person. Yeah. So I definitely don't want people thinking I'm anti. And I really appreciate you talking about this because your tale here to find out how does this affect, how does this connect to something else? You know, is this going to cut off something I might want to do? Might help somebody else make a better decision or different decision, or help a doctor go, whoa, I didn't even think about that. Yeah. Because a lot of people don't think clinical trials when they're well. Yeah. They think it's a last ditch Hail Mary, and they're really not. Yeah. I mean, that clinical trial would be something to be monitoring you. Yeah. You're not actively ill. Yeah, I am not closing the door completely for the clinical trial. When I emailed the Dana-Farber that, hey, I have expander, I can't do clinical trial. And then they said something like, yeah, next spring, when you decide to take the expander out, just let us know. We may be still able to do it. So I am still hopeful that I will be able to contribute next year. But Terry, you're very right. I feel like for IBC patients, because we have to do chemo and then right away we have to do mastectomy and then right away we have to do radiation. It's like a constant urgency, right? The urgency is there to get the next thing done. So we don't really have time to sit down and think about, okay, like, do I want to get reconstruction done or do I not want to get? I mean, we don't have time to think about that. And so when we don't, and there's limited information available. I mean, it's getting better, but it's still not. And also too, I'm sorry to interrupt, but like sometimes, and one doctor explained to me that he could give patients expanders. He said that is delayed reconstruction. He goes, I'm putting in the expander pocket, and then I'm going to let her do radiation. Then I'm going to put the expander in. I said, so to him, delayed reconstruction just meant not the same day as the mastectomy. So one of the things I've asked the consortium, they just had meetings recently in Texas, and I said, can y'all elaborate on exactly what does delayed reconstruction mean? And say, and only these procedures, because the only approved procedures are a DEEP or a tram, where they take the muscle from around the back and bring it to the front, the skin from the back. the deepest when they take it from the tummy and they build the breast mounds. But to make it very clear, there are some things you shouldn't do. And I kind of joke, like when one of my sons one day did something when he was dumb, when he was a little kid, and I started going down the rules, things you shouldn't do. And he goes, well, you never told me I shouldn't do that. And I said, well, okay, don't catch your hair on fire. Don't snip the end of your nose off. I started talking about the things you shouldn't do. And I almost wish these doctors would list, by the way, this is not preferred. Don't use this. Don't do this. This is preferred.
Yeah.
Because that lack of definition, I think, gets in their way too.
Mm-hmm.
What do you think?
Yeah, I mean, I think so too. I totally agree with you. But I feel like personally, I keep going back to how we don't have, lack of information for IBC patients. Yes, I agree with that.
Mm-hmm.
But I feel like more than that, it's that anxiety or urgency in us that, okay, we got to say yes because doctor knows better than me and I need to get this done now. And so we just don't have time to sit down, and we don't have like 2 weeks time frame to sit down and don't do any, treatment and whatnot. And, like think about, okay, like, okay, let me just think about this next step. We don't have that kind of time. And so it's very stressful for the patients.
It's very stressful. And also too, I had a friend say something. She said, it's like drinking from a fire hose.
Yeah.
It's just, everything's just coming at you so fast, and I know for myself, I was misdiagnosed for 4 months. So by the time I got diagnosed, I was not firing on my cylinders. I did not feel good. Everything was like the Charlie Brown cartoons, womp, womp.
Mm-hmm.
I wasn't snapping on everything. And like you said, not even the time to research it. And then also it's confusing when you see conflicting information. Who do you believe?
Yeah.
And I've seen a lot of that.
Yeah. So that's why I decided to get second opinion from Dana-Farber. And actually getting the reconstruction done. I mean, in the beginning, I was like, I just want everything removed from me. I don't want it. I don't want my boobs. Just take them all out.
I get you.
So that was me in the beginning. But then after all the treatments were done, I was like, oh, I miss my boobs. I think my kids miss my boobs too. And I'm sure my husband misses my boobs too. So like,
it's part of your body. You're meant to have them. Yeah.
And whatever clothes I wear, it just doesn't, like the boobs played so much role for us. And it was like a big anchor for us when we're wearing a dress or a blouse or something. It's a really like, we had this beautiful figure, and that's gone. And that's so like few weeks after the radiation treatments was done, that's when I truly realized I want reconstruction done. Whether that's 2 years down the road, a year down the road, I want it done. But I need to take care of this expander situation now. But ultimately, I want to get the reconstruction done. So you may change your mind multiple times through your journey. But that's okay. And reconstruction can be done, as you say, delayed reconstruction is an option for us. So take your time to think about what you want to do, and take one step at a time.
I know. And it's one of the things I really like, if I can, I try to encourage women to go to one of the clinics for some kind of check throughout the time. And I know it's expensive and it's hard. It's not available to everybody. But I always tell women, if you were going to get your kitchen remodeled, you wouldn't get just one estimate. You would talk to a few contractors. This is a really big decision. So I think if you can get that consultation in, and a lot of places think if they go somewhere, they'll have to do all the treatment there. And usually they'll tell you, we're really happy to have you get chemo anywhere. It's like, it's a glass of iced tea. It's not that different. That cocktail is what it is. And where it can get a little bit more fancy, I call it, is with the surgery and the radiation. And sometimes that's something women do decide to do at a specialty center. But even if you don't, if you have that second opinion, sometimes they'll work together. And what happens is both communities gain something. The institution, the second opinion clinics usually get more tissue, blood sample, things like that to help them with their science, their research. And then usually the outlying smaller hospital can get a bit of an education level and a relationship that can benefit a local patient. So it's a bit of a win-win.
Yeah.
And I don't think people think of it that way. And I know I'm in Texas. We like to think we're the South, but we're really the West. But we think Southerners are nice. We want to be nice. The idea of telling a doctor, I'm going to go somewhere else, we worry we're going to offend them. Now, you're a Northerner. Do you worry about offending your doctor? I think Southern women worry about offending their doctor.
No, because it's my health. Whoever I see is my decision. Second opinion, third opinion, I'm gonna have to do everything to get better for me and my family. And I don't think my doctor will be offended. I never thought about, okay, will my doctor will be okay if I tell her that I'm gonna get second opinion? I mean, I think my doctor will be happy that I am advocating for myself. She's
Good.
that kind of doctor. I never felt like she's like, oh, like, do you not trust what I am doing? I never felt that kind of vibe from her. But regardless of that, it's your health and you do it for you. Second opinion, third opinion, go get it done. If you feel not, if you feel like something's not right with your current doctor, go get it done. It doesn't matter what your current doctor, says and thinks. It's your body and it's your health.
Well, and one thing I hear from women a lot is, oh, I don't want to upset my doctor. I don't want to make it hard on my family by being traveling. I don't want to incur expense.
Yeah.
And one thing I tell them all the time, it changes the conversation. What if it was your kid? Oh man, I'd be on that plane tomorrow. I said, well, put yourself to the front of the line, because I think sometimes we don't put ourselves to the front of the line. Part of it, I think we're a little bit scared, and there are realistic expense issues and other issues. But I think sometimes that second opinion can really give a lot of confidence to where you are.
I feel for the families who can't really, for whatever reason, who can not get second opinion. I'm very blessed that my husband is supporting me really. Like, he's like, yeah, if you need to go to Boston, go fly to Boston, I'll take care of the kids. So I have really good support system. But yeah, I feel for the families who don't have that option. It really breaks my heart.
I get it. I've seen a lot. And one of the things I've seen a lot, honestly, discourages women from getting a second opinion. And sometimes family members, because it's scary to think that you can't get what you need locally. So sometimes we actually did the IBC network did a poster in San Antonio where we did what was the delay for women getting a second opinion. And we really thought it'd be financial toxicity. It wasn't. It was family members discouraging them from doing that. And I thought that was really that was a surprise. That's how we thought it would go. But you've discovered a few other little things you wanted to talk about some of your stiffness. And you mentioned at the beginning, wanting you met with someone about intimacy, but you also just kind of assumes this was your shoulder, but you found out something new that you can treat about the osteoporosis.
Yeah. So the latest bone scan shows, I'm gonna have to pull up the exact name of this diagnosis. The latest scan showed osteopenia. So it's like a step below osteoporosis. So so I started to, of course, Google since yesterday, what is it?
Yeah.
But I had an aha moment yesterday that, my shoulder feeling kind of weak, when I am sitting in front of computer for like an hour or two, and then I get up, it takes me a couple seconds to put myself together to be able to move. Because I feel like really like my bone feels kind of weak. And, I had that feeling for about a month or so. And the bone scan showing, and I also did like a DNA testing, but to find out what nutrients is lacking in your body with my nutritionist. And it revealed that I am lacking in vitamin D, especially. And so that's related to your bone health too. So like all of these things combined, I'm like, yeah, it makes sense that I have issues with my bone. So again, I have an appointment with my oncologist next week to figure out like the medicine pills or IV side of the things or something like that that I can do. And I'm talking to my nutritionist about supplements that I can take for situations like this. So it's probably, I'm not a medical doctor, so I can confirm, but it's probably caused by chemo, radiation, and all the good stuff that we went through. Yeah, so that's like a new thing that I discovered just yesterday.
Well, I'm glad that you're sharing that because, okay, one thing I had a doctor explain to me, and I've never seen it written down in a scientific journal, but I've heard this from several, is that the treatment artificially ages us. And so what was going to come, 20 years later comes sooner. And so, maybe a little arthritis or, it's that I call it creakiness. I know when I get up, I'm 64, and when I stand up, I feel like you should hear my bones creak. I feel fine. My stamina's good. I can walk all day.
Yeah.
But I get that beginning movement. And, you've inspired me to go back and ask for a bone density test because sometimes I just kind of clock things up to my new normal.
Yeah.
And don't think about the fact there's something I can do about that.
Yeah. And again, this is another testimony that how I love my doctors. Sometimes I'm like, really, I need to see you again. But they're really good at like I still see medical professionals. So my treatment was done back in August, and since then,
let's say you're only a year out.
Yeah, and I still see them every week. I have some kind of doctor's appointment, and it gives me assurance that like my medical community that I belong to, they really care about my care. And I'm really blessed that I have really good medical system and support system here. But the what is it? That
was osteopenia.
Osteopenia. I'm a little bit concerned because I'm really like outgoing and active person. So I would love to continue to do camping and hiking and running around with kids and whatnot. And so I am going to try to get best care and take care of it so that I can continue to do activities that I enjoy. But man, this radiation and chemotherapy, the after effect, oh man.
Well, your mom, you've had a baby, and I know you had twins, so that probably was a bit longer recover. But I tell them all the time, when you had a baby, you just didn't bounce right back. You need a little time to recover.
Yeah.
I don't think we give ourselves permission time to recover as we close treatment. I know some women never get out of treatment. They're lifers. They're in treatment forever. But for those of us that, did have that fortunate situation where everything worked and we're being monitored, I don't know that people understand, or we understand, we need a little time to get stronger and better.
Yeah. So what really pisses me off nowadays is people who do not know about cancer. So end of August was my last treatment, and then my doctor said that I'm in NED. And when I tell that to people, they're like, "Oh, so you're good to go." Like, so I am like totally fine from September 1st. But it's not that. It's like once you have cancer, it's kind of like it's a long-term thing, or maybe it's forever thing that you have to take care of your body and you continuously have to take this medicine and go see your doctor. But people don't know that, and they sometimes get frustrated that I cannot join them for hiking or something like that, because in their mind, I should be completely fine. So that really,
you don't just flip a page and you're better. Yeah. And also too, there's sometimes some serious financial toxicity. I remember when I finished all my treatment, my friends were like, "Oh, think of all the money you're saving, not having to pay all that parking and drive and go to the doctor all the time." It's like, are you kidding? There's still a bill.
Yeah. And we probably will get bills from, our medical doctors and hospitals like a couple of years after, right? I'm still like waiting for, I feel like I need to pay some more. So I'm sure I'm going to get some kind of bill next year, January, February. I'm going to get a bill for something that I done back in April last year or something. So yeah, so it never ends. And then like just thought that I had cancer, that thought just never goes away. I have cancer. My boobs
I
are
rem
disfigured. It just never goes away.
I remember I'm 15 years out. I remember every morning when I woke up, the first thing I thought was when I was diagnosed, I have cancer. And I realized one morning that wasn't the first thing I thought of when I woke up. But it was years later. It was years later, and so it does, I think for me anyway, it got easier, but yeah, it's in your head. And then there's time of things like lost. And I mean, obviously it's like you have a very happy marriage, and a good support system, but that year you were in treatment, you weren't being the same kind of wife and mother
Yeah.
that you maybe want to be. I'm sure you're doing the best you can, and I'm not saying anything bad happened. It's just that you were having to do other things. So I think there's some filling in the gaps that we have to do too,
Yeah. Yeah.
afterwards, that people
Yeah.
don't think about, takes time and energy,
Yeah.
you know?
And I feel like during the time my 7-year-old girls, they matured a little bit. So some mornings when I cannot get up, they would make pancakes and bring it up before they go to school. And then they would be like very gentle. Still to this day, they're very gentle, hugging me because they know I have this expander and then one boob is missing. But it was pretty interesting. About 2-3 months ago, we were very transparent with our kids about what mommy is going to go through. About 2 months ago, one of my kids were just touching my body, and then she like realized on that day that my boob was missing. It was like first time that she actually felt it being flat. She had the concern in her look, and she's like, "Mommy, what happened to your boob?" And I told her, well, we had to remove the bad things, and that's why mommy's okay. And we told you that, remember mommy went through surgery, and that was about that. And then 5 seconds later, she's like, okay. And then she's playing with her toys. But to this date, I feel like my kids would have that moment that, oh, mommy's not right, or oh, mommy had cancer, so she cannot do this. And so even our kids would have that realization that from time to time, mommy has cancer. Mommy needs to be careful. So it's not only having cancer has long impact to me and my life. It has certainly have impacts to my kids and my husband as well.
Mm-hmm. And it's interesting because I know I've been through that with my family, that I've told them things, but sometimes there was a different understanding, and I think sometimes it sounds like you're doing a lot to teach them compassion, because you're teaching about something, but you're not coming at it from an angle of a victim, or this is a reality. This is what we're doing, and we're okay. And I think that's a great way to handle it.
Yeah.
Well, we've been talking for almost an hour.
Oh,
So
okay.
and I hope if people are listening to this on podcast, they also see it on the web, because I'm getting to see your great smile. And it is just so happy and hopeful. And I hope that you'll be in touch with us after your visits to see, kind of continue the story. But what would you want to be a parting message to someone who's heard this today, about either something for them early in the journey, mid journey, as they go through making decisions? What would you want to say?
I know it's a lot that you have to do, but make sure you do your own research and reach out to people who had IBC and get their experience, and write them down, make a record.
I know.
Yeah, and then go visit your records and your notes from time to time to remind yourself of the things that you learned and things that you need to be mindful of. And if you don't feel comfortable with your doctor, go ahead and get second opinion and seek other help. So those two things are: do your own research and getting second opinion, and finding the doctor that you really can trust. Those are the two messages that I want to share.
I think that's a great message. Well, Ivy, thank you so much for sharing with me, and I'm so glad to see you. I know things are going well. I can't wait to hear what you find out. And thank you for being with us today.
Yeah, thank you, Terry, so much for giving me this opportunity to share my story. Yeah, I will keep you updated on the next steps.
I appreciate that. Take care.
Okay, bye.